With this, hospitals throughout the country are facing a growing shortage of doctors, raising real concerns about gaps in medical services. Our Song Yoo-jin has this report.
As the nationwide walkout of trainee doctors enters its third week, hospitals are grappling with an increasingly severe shortage of medical staff. Despite the government's warning of license suspensions for doctors who do not return to work, the majority of trainee doctors at hospitals across the country did not show up for duty on Monday. Here at Chungbuk National University Hospital in Chungcheongbuk-do Province, only 8 out of more than 120 who have received return-to-work orders showed up to work. Because of this, only 40% of hospital beds are currently in use, and its emergency room can only accept 1/3 of its usual patient load.
The CT scan results have been delayed for 2 weeks now. We need the results as soon as possible to find the cause and proceed with the proper treatment. But the patient isn't feeling well, and the results aren't out yet, so it's frustrating.
However, these hospitals are expected to face an even more dire shortage of staff due to the absence of new trainee doctors. Hospitals had hoped things would get better when newly appointed interns and residents were due to start in March. However, on Monday, the first workday of the month, even the country's 5 major hospitals located in Seoul did not see the majority of their new trainee doctors. Around 90% of soon-to-be interns at major hospitals in Seoul reportedly withdrew from signing their training contracts last week. While fellow doctors have been filling the healthcare void left by those who resigned, some hospitals are now seeing these doctors also leave their positions. For example, in Jeollanam-do Province at Jeonnam National University Hospital, out of the 52 new fellow doctors, 21 gave up their jobs, and 13 out of 16 did so at Joseon University Hospital in the city of Gwangju. In Dankuk University Hospital in Cheonan, Chungcheongnam-do Province, only 5 out of 10 fellow doctors have signed their contracts. To help address this medical void, since last month, 12 military hospitals have opened their emergency rooms.
My father broke his hip joint, and because of his existing health issues, finding a hospital for surgery was a challenge. Many hospitals were unavailable due to the walkout, so we were feeling stuck. Then, we saw on TV that military hospitals were opening their emergency rooms to civilians. We gave them a call, they said yes, so we rushed to the hospital.
According to Seoul's defense ministry, so far, more than 120 civilians have received medical services at these hospitals. Song Yoo-jin, Arirang News.